Hello and welcome to this short video on cannulation, which will go along with the venipuncture video which Ali has recorded and is available for you. In this video what we'll do is we'll talk through the skill of cannulation. We'll give a demonstration of that. So before we start, we need to make sure we have all of our equipment ready. The first decision to make is the reason why we're cannulating the patient. So we need to think about the size of cannula, and that should be driven by the indication for venipuncture. In this situation here, we're going to use a pink cannula or a blue cannula, which is what we've got available. But if you needed to infuse fluids over a fast period of time, then you would be wanting to think about a larger cannula. As with the previous video, we need to think about skin prep. So we've got two choices here. We can be using a Surette or we can use a ChloraPrep, and that will be guided by local policies. We'll need some gauze available for when the cannula is inserted, and also for removal of the cannula. We'll need a tourniquet. As in the venipuncture video, we do have two styles available here. We can either use the disposable one or the non-disposable. In clinical practice, most areas now have the disposable tourniquets. However, the principles are the same with both of them. And finally, we'll need a dressing, an adhesive dressing, to secure the cannula in place. In some areas, you may have a pre-made pack, a venipuncture and cannulation pack, which would have a sterile field in there as well. So before we start, first thing I'm going to do is attach the tourniquet. The reason why we do this first of all is just to identify where the best site for cannulation is. So it doesn't need to be too tight. You can see I've got two fingers underneath there, and what that'll do is that'll start to distend the vein. I find it's best if the patient has the arm relaxed on a pillow, whether they're sat in a chair or on a bed. But if you're relaxed on a pillow, and if you're cannulating near the hand, you get them to hold your hand. Two purposes to that. One is that you can stretch the skin over the cannulation site, and secondly, you have control of that area. And often when the needle punches the skin, there's a little bit of a jump there, so you just have a little bit of control over that. So today we'll be cannulating the back of Ali's hand. What we can do for the time being is we can just remove the tourniquet. Doesn't need to be on unnecessarily. And I'll wash my hands and clean my hands. I've got some alcohol gel here. We'll just rub this in and allow this to dry. And then select gloves. Non-sterile gloves are fine to use for this procedure. We don't need to be opening sterile gloves. I'll select some medium gloves there for me. Whilst we're getting ready, we'll use the ChloraPrep to clean the skin. So as in the previous video, this has a glass vial inside, and what we need to do is just squeeze that, and that'll break as we squeeze it, and that'll now release the ChloraPrep onto the sponge at the end. And we can clean the site using a circular motion. And allow it to air dry, because that's glass that can go in the sharp bin. Whilst that's drying there, we can get our cannula ready. So in this case here, we're going to use a blue cannula. We just peel it open. The cannula itself, when you take this out of the packet, should be kept clean, so we need a clean area to keep it. We'll keep it on the kidney dish for now, and when I've got my gloves on, we'll pick it up and open it. We're going to open our tegaderm. The tegaderm should be a perforated one, so we can fit the cannula in there, so make sure you haven't got one that's complete. And this is now dry on here, so I can put my gloves on. I could also take a blood sample whilst I was cannulating as well, and if I was doing that, then we would need a vacutainer system as well to connect. And the final piece of equipment, what we would need, would be something to flush the cannula when it's in. So we'd need some water for injection or some saline and a 10ml syringe. However, that would need to be prescribed. As student nurses, that wouldn't be something you'd be given without the supervision of a nurse, and certainly not without the prescription. So now this is dry here, we can pick up the tourniquet. And again, doesn't need to be too tight. I'll take the cannula out of the packet. So when the cannula comes out of the packet, it has two wings on here, and these wings need to be folded down. So just fold them down. And what that'll allow is for control over the cannula when it's being put in. The way to hold the cannula is to put two fingers on the over the wings and your thumb over the cap, and that will allow you control of the cannula when you're inserting it. The reason being is there's three parts to a cannula. There's the sheath, which we'll take off now and throw that away. The cannula itself comes in two parts and separates, and if you don't have control over both parts, when you puncture the skin, they will separate. What you can also do at this point is remove the cap off the cannula. That's easier to put back on after you've inserted it. That can just be put into your tray. So take hold of the hand. By using my thumb on the back of the hand, I'm not putting my thumb anywhere near the puncture site. I've not touched the puncture site, and it just keeps the skin taut. If you didn't have the skin taut, as you go to puncture the skin tends to ride up a little bit. Now I'm going to insert this on a 45-degree angle to the patient's hand. So we're going close to the skin, and what I'll do is I'll just warn the patient now, sharp scratch. I will insert the cannula at 45 degrees. And what we can see if we pause is there's a flashback at the tip of the cannula, and that's given us confirmation that the cannula has now punctured the vein. We need to just advance a slight bit further forward to ensure it's in the vein. And now with control of the wings and control of the needle, we're going to separate the two parts of the cannula, and my left hand is going to move and my right hand is going to stay still. And we're just going to advance that cannula into the vein. And the needle here stayed completely still. We can remove the tourniquet now, because that will now stop any bleeding or minimise any bleeding. And that's actually quite secure now within the hand. Don't need to hold on to it. We'll take a little bit of gauze and we can just lift up. And the reason why we're putting this gauze in here is when I remove the needle, there may be a drop of blood that comes out of the cannula, because we've removed that plug. With my left hand, I'm just going to press over the cannula site, and that again is reducing the risk of any bleeding, and I can remove the needle from there and insert it into the sharp spin. And at the same time, attach the cap. That cannula is now in the vein. If I was going to take a blood sample, I'd have taken that before I put on the cap. And now using my Tegaderm dressing, I can secure that into place. So checking the patient doesn't have any allergies to these types of dressing. And the dressing has a little slit in it. The slit will go over there towards the cap of the cannula. And what that's now done, as we stick it down, is secured the cannula into place and also covered the puncture point where the cannula enters the body. Remove this white outer dressing. And then on here we have a space where we can write the date of insertion and attach that to the cannula site so we know when it was inserted. We would then need to flush the cannula, so using some saline or water for injection and flush it, and what we should see is that would be painless. It may feel a little bit cold, but it should be painless as that's been inserted. And that cannula can now stay in to be used and removed when appropriate. To remove the cannula, when you've finished using it, what equipment we need is gloves. We'll keep these gloves on. We've got clean hands. We'll need some gauze and somewhere to dispose of the cannula, to put the cannula in. The tricky bit is getting the dressing off the patient because it's often quite sore. So we just need to peel it round and take your time. What I tend to do is secure the cannula with my finger, because that tends to stop it sliding around and causing further discomfort. You can just take your time moving this sticky tape off. With a piece of gauze, we can fold this over the tip, gentle pressure on there, and the cannula will just come out in one smooth motion and go straight into the bin. And this will now just need a couple of minutes pressure, which the patient can do whilst the bleeding stops. Thank you.